Hi, everybody. I am Dr. Heather Flexer, Doctor of Physical Therapy with Better Winds. And today I have Belisa Saavedra-Kinnard. She is a doctor of physical therapy also, and she is the author of a book, Breaking Free from Diabetes, Your Complete Guide to Reversing Type 2 Diabetes. And I'm so thankful. Thank you for coming on. I can't wait to have this discussion with
Thank you for having
today.
me.
Yeah. So tell us a little bit about your background with diabetes.
Okay, so I myself had gestational diabetes twice with my children. And after my second child, I ended up with prediabetes. And so at that time, my dad had already been diabetic for about a year, and he was struggling with controlling his sugars. And then he ended up actually passing away 3 months after my second son was born. And so at that point, I decided, you know what, I have to make a change because I don't want to go through the things my dad went, and I don't want to leave my children motherless. So that's when I finally decided to invest in myself and do something about it to prevent full-blown diabetes.
So is diabetes hereditary?
It is partly hereditary, but it's mostly a lifestyle thing. And so, you know, in our family, you know, the way we ate and stuff, I mean, it wasn't horrible because it's not like my mom had like all kinds of fried foods and stuff. It was just the fact that being a Latino culture, you know, rice is a huge staple in our family. And I believe, you know, that kind of, you know, was passing on to us. And so I was trying to make those changes early on as well before I got pregnant, just because I knew that, you know, I had to make changes for myself and my family in the future.
So what are some, besides diet, what are some other risk factors for developing type 2 diabetes?
Yes, there are several risk factors actually. The age is one. They say people that are over 40 are more susceptible to developing type 2 diabetes. Obesity, as you know, is one of them as well. Then having a history of heart disease or high cholesterol or strokes, those are also factors for developing type 2 diabetes. And sex used to be a risk, like a risk factor. However, women were more susceptible, but now that number is actually catching up with men. So that's kind of becoming an equal thing. So it's not really a big difference between men and women developing it. And then the other thing is race. Diabetes is very prominent amongst African Americans, Latinos, and American Indians. So, you know, those are the races that are affected most by diabetes. And again, there are many factors that are included in that, you know, socioeconomic status, you know, culture, things like that. So, and I believe that's why those races tend to be a little bit more high risk when it comes to type 2.
Yeah, I mean, food's a huge part of culture, so
Mm-hmm.
it would make sense. So not everyone knows if they're diabetic, right? Like we hear about this all the time that people didn't even know, and then they're like full blown
Yes.
diabetes. They miss that like pre-diabetic window where I think there's a little more capability to reverse it. But what are some symptoms that people might identify in themselves?
Yeah, so, you know, it is very important for people to, you know, get annual checkups because, you know, that's how I found out I was pre-diabetic. I had my annual checkups with my doctor, my annual physicals, and they do blood work. And I told them, you know, check my cholesterol, check my triglycerides, check everything and make sure that my numbers are in check. And a lot of people don't realize that, you know, these are important numbers to have checked every year. And so one of those was my glucose and my A1C. And that's when they found out that I was pre-diabetic. My dad, on the other hand, he did not know until he started having symptoms and pain, and he didn't know why he was having these things. And so some of the symptoms that he was starting to have were blurry vision. He was having more trouble driving at night. He was having excessive thirst and urination. And again, that kept him homebound a lot because he was always afraid he wasn't going to make it to the bathroom because he had to go to the bathroom so much. And so so that's another list. There's a huge list of them. Also, weight loss, even though people may not think that, but a lot of times with diabetes, our muscles are affected, and there's a lot of muscle atrophy, and therefore we're losing muscle mass and not so much fat. And so people say, well, I'm losing weight, but unless you're actively trying to lose weight, it's not from, losing fat weight, you're losing more your muscle weight, because that's diabetes attacking your muscles. Neuropathy is a huge one, when people start to feel the tingling and numbness in their legs and feet. And unfortunately, neuropathy is not something that can be reversed when it's full blown or when it's affected you for a long time. So if you can nip that in the bud as soon as possible, by controlling your blood sugars, then you could certainly avoid that aspect. My dad also, he had like varicose veins in his legs, and they just seemed to get bigger and bigger with his diabetes. And one day they just popped, and he had literally it looked like a massacre on the floor because it just exploded. It was ridiculous. And so things like that are also, and one of the things as someone else had mentioned, I believe you mentioned it, Heather, on one of your other posts that I saw, wound healing. Diabetes affects wound healing, as you know. And so if people are noticing that, they get a cut and it's taken longer, then, that's probably something that, you need to check with your doctor and see about your A1C and see if everything's in order.
And the A1C is a measure of what?
Basically, the A1C is a blood test where they measure an average of 3 months of what your blood glucose was in the past 3 months. So how they are able to do that, I don't know, but it's neat, because then it kind of gives you an average of, okay, have I been good in the past 3 months, or and a lot of things could affect that, with your A1C. But, a lot of people think, well, I'm not going to eat any carbs right before my doctor's appointment, so they can, tell their doctor they're doing great. But your doctor will check your A1C, and they'll know in the past 3 months you haven't been doing great. And just because your blood sugar is low today doesn't mean it was low, in the past. So.
Yep. Okay. Yep. So we hear all the time that diet and exercise can help. Do they really have an effect?
Oh, most definitely. A lot of people tend to gear more towards the diet, and they feel like if they eliminate all their carbs, then they'll be good, because now they're getting rid of the carbs. However, what they don't understand is that the reason that your carbs are elevated in your body is because your insulin isn't being utilized correctly. There's something in your body that's keeping your insulin from taking that glucose from your blood and into your muscles for energy. And number one, inactivity is one of those, because if you're not active, guess what? Your body's not going to utilize that insulin because you don't need it. You're not using your muscles. And so that's the first reason. The second reason is because if you have too much fatty acids in your blood, those fatty acids start to stick to the receptors in your blood or in your muscle cells, which need to be open for your insulin to activate the channels for the blood glucose to enter your muscles. So if you're full of fatty acids, then guess what? Your insulin has nowhere to attach, and therefore it cannot activate your blood glucose channels to open up and use up that blood glucose, and so it over fills in your blood. And unfortunately, that's one of the things that, a lot of people on the keto diet, the keto diet is great for to initially get that the fat utilization going. However, it's not sustainable. I read an article that they had a research article that followed people for 2 years that were on keto, and they found that even after 2 years on a keto diet, people were still becoming insulin resistant. Now, why is that? Because they are filling their diets with higher fat content, and therefore that fat content now starts to attach to those muscle cells and starts to block the insulin receptors. And so people don't realize that And the way exercise works is that when you exercise, that activates these receptors. It activates your insulin to get on these receptors to use that blood glucose in your body. And the more lean muscle you have, the more receptors you'll have, the more opportunity for your body to use those carbohydrates. So that's why it's important to incorporate exercise, because exercise not only helps reduce your fat content, it also helps to increase your muscle content. And so those are the two important things that affect your blood glucose and your health in general. So it's a hand-in-hand type thing that needs to happen, that people need to realize that, yes, diet can get you going in the beginning, but you need exercise to help sustain it in the long run. So if you really want long-term results, you must include some sort of activity into your diet, or into your life, into your lifestyle. And so they go hand in hand.
None of us get away with not being active.
That's
it catches
right.
up with us in some way or form or fashion, right?
That's right. That's right.
So you mentioned you had gestational diabetes, and that's a little, how is that different?
Well, gestational diabetes is different because it happens when you're pregnant. And a lot of times, when we're pregnant, our hormones are all over the place. And insulin is a hormone, and therefore it's going to be affected when you're pregnant. Now, the key is your body able to balance itself when these changes occur? And sometimes it does, sometimes it doesn't. Again, if you're overweight before getting pregnant, it's going to be harder for your body, because now you have these hormonal changes and you have less receptors for your insulin because you've been overweight. And so it makes it more difficult. When I was with my first child, I tried to control it with diet and exercise. And I didn't even gain more than like 15 pounds when I was pregnant with my first child. But for some reason, my sugars still weren't under control, satisfactory to the doctor. So my doctor and I, we discussed, okay, what medication is the best medication to protect the baby and myself? Because I didn't want this medication going into the placenta, through the placenta and into the child, and then, affecting my baby, because nobody really knows how medications affect the fetus. And so my doctor and I, and this is something women need to discuss with their doctors and really be adamant and advocate for themselves as far as what medication they want to use, because there are different types of medications classified A, B, and C, and depending on which one you choose, that depends on which one can actually break through the placenta barrier. And so I chose the one that was that would least affect my baby. However, even with medication, yes, it controlled my blood sugars, but it stopped my baby's growth. And so, the main concern for gestational diabetes is that women have bigger babies. And so these babies come out like 8, 9, 10 pounds when you have gestational diabetes. And so after taking the medication, the baby was growing fine. And then all of a sudden at 36 weeks, they're like, well, he stopped growing, and we need to induce him. Now, induction actually increases your risk for needing C-section. So I ended up with a C-section, and he came out at only 5 pounds, 12 ounces. So he was a very small baby. And so with my second child, I told the doctor, I'm not taking any medication. If my baby comes out a little bigger, then that's fine. I will control my diet and exercise. A lot of women feel like they can't exercise while they're pregnant, but that's a misconception, because you still can exercise while you're pregnant. It doesn't mean you have to go all out and do snatches and things like that, but you can still, walk on the treadmill, go for a walk outside, do things like that, keep yourself active in order for your insulin to be regulated better. And then with my second child, he came out 8 pounds, 9 ounces or something like that. So it's still a healthy weight for a healthy baby, and he came out in 39 weeks versus the 36 weeks of my firstborn. So it goes to show that, diabetes could definitely affect the size of your baby, but the medications can also affect how your baby grows. So just be careful with that. And, if you want to avoid medications, the best thing to do is to eat right and move better. A lot of women think, I'm pregnant, I can eat whatever I want. Well, no, not necessarily.
Don't do it.
Because you're going to pay for it afterwards, when you
You're
gain
gonna
the
have to
extra
lose
weight.
it. Yeah.
Yeah, exactly.
Yeah.
So,
And you need to be moving, right? For
exactly.
in order to get through that labor, you better be ready. It's
Exactly.
marathon.
It is. It is. Luckily, I skipped the marathon because I had a C-section, but you know, I was mentally prepared for the live birth, but you know, when it came to the C-section, I was not. So, but the second time around, I was like, they always say prepare for anything. So
Yeah. I wound up with an emergency C-section, so I get it. After,
mm-hmm.
yeah, it never goes like you plan, but
Mm-hmm.
absolutely. So you are developing a wellness program, is that right?
Yes, yes. I want people to realize that, you know, if you're at high risk for diabetes or you're pre-diabetic, that is the best time to get on a wellness program and either prevent the diabetes or reverse it. Because once you're deep into it, it's a lot harder to reverse the symptoms, to reverse, you know, any of the effects of it. So you still can control your blood sugars, but you may or may not get off medication. So you know, you really want to catch this right before it becomes full-blown diabetes. So I want to offer people a wellness program, just like I was able to invest in myself and be able to, you know, decrease my weight, increase my activity levels, and decrease my A1C and keep it that way. So, you know, one of the things about a wellness program that includes physical activity is that your A1C will drop, but it will remain low and even drop lower as you go on. It's a long-term commitment. It's a long-term result that you get. So I want people to realize that, you know, and the thing about a wellness program too, for me at least, you know, as a physical therapist, I knew what I had to do for exercising. And I also have an exercise physiology background. So, you know, I know the effects of the heart and how, you know, all these other things that you have to think about, your heart rate, you know, what zone you want to be in when you're trying to lose fat versus gain muscle, you know, what type of strengthening exercises you need to do. So I knew all this. However, for me, it was the accountability, because I am a person that is always trying to please others. So being accountable to a group helped me to stay on track, helped me to say, okay, my group is expecting us to, you know, push each other along. And therefore I was able to stay on my exercise program and be able to, you know, accomplish what I did. So I think that's the one of the main things about a wellness program is that we provide that accountability. And then alongside with a nutritional guide, you know, working alongside a registered dietitian. You know, people could choose to also go out and there's a place here in Lancaster where it's called Clean Eats, and they basically do like meal prep for you, and then you can purchase them. So I am looking to partner with them to help people, you know, get a discount so that they can start like a meal prep with them. And then that way you don't have to think about what you need to eat, because they offer low carb, high protein, things like that. Depending on where you're at in the program and what your needs are for your body, then that's what you choose to eat at that time. And so, so that's the other thing. And then, of course, you know, the exercise portion, we give you exercises. And I know for a lot of people, it's hard because, you know, you start an exercise program. Like for me, at least, when I started with the online program, the exercises started out easy, but then things started to get a lot difficult. And I'm like, I'm not at that point yet where I can do those things. Like people are like I said, snatching weights up, and I'm like, but no, I'm not there yet. You know, I have a bad back.
Yeah.
Yeah. And so I was like, I want to create a program that's not scary for people. I want a program that, you know, people could look at the exercise and say, you know what, I think I could do that. I know I can do that. And they try it and they see that they can. And even if it's not, you know, the prettiest or the best form, at least you know you can do it, and then you can gauge yourself as you go along and see how well you get at it. And so I want to make it something that's simple for people, just like with the book. I wanted something simple because nobody wants a lot of information thrown at them at one time and then not know what to do. It gets overwhelming. So so that's what the wellness program is going to entail. You know, easy to follow, accountability, and nutritional information to keep you on track with that too.
Awesome. And that's going to be, they can reach you in person, but is it also going to be online?
Yes, it will be online. On our website, we have a link for people to sign up, and then they would fill out a form, and then we would get in touch with them to get them started with it.
And I'll post a link to that, but it's madeformotionllc.com. Is that where they would find you? You're
Exactly.
on Facebook, Instagram, Pinterest, Made for Motion LLC.
Yes.
Thank you so much for sharing all this information. I'm going to go ahead and post a link to the book. I'll put all her, Belissa's information below. Yeah,
that's what it looks like.
Yep. That way you know you got the right one.
There's a lot of books out there, so.
Yeah, we'll post a link below. Thank you so much. And
thank you for having me.
all right.